I'm Suzanne Feetham, and I have had the privilege of attending all of the family nursing conferences since the first one in Calgary, and this has been over the last 25 years. It's been tremendously exciting to see the growth in the research and scholarship in the research of families over this time. I have been a nurse for 50 years, and my first child I took care of as a student at the University of Michigan has been a major guiding force for me throughout my 50-year career. It is through Anne, who I still have contact with, that her mother asked me to start the parent group in Michigan. From that, I became involved at the state level in changing care practices for children in the school system with disabilities. I went on a governor's commission, and from that moved forward into the national level. I mention this because one of the things I've developed skills in over these 50 years is in the policy arena, and that's something I've been asked to talk to you about. Nurses who are committed to family nursing must be able to communicate the significance of the family unit as a family unit for health care and the outcomes of nursing care in improving the outcomes for families. In order to affect policy, we must have the data to be able to convince policymakers, from individuals and institutions, from the president of a hospital through the federal national policymakers. If we cannot be specific about what we do and share our data and have the data to document our outcomes, we will not be able to affect the change we want and change the healthcare system to really have the family as a unit of care. We all know that the family is the context of health, and the World Health Organization has a global goal for family care. Again, we cannot accomplish this without our ability as nurses, nurse scientists, nurse educators, and nurse clinicians to document the outcomes of our families. We must be able to frame key messages for policymakers, and this is something I have learned in working with policymakers at the local, state, and federal level. We have to be able to speak our language in the language of our policymakers. And this is a different language in the goals and priorities for every country. We need to develop an elevator speech. If we see the president of our hospital walking through the hall or in the elevator, we approach them, say, "Good morning, President James. Are you aware that we've just completed a nursing study on our unit, that we have been able to demonstrate that we've reduced readmissions for our children with cardiac defects by family engagement? This, as a result, has improved the care and outcomes for our children, but we have also reduced the cost on our units by 20%. Strong message, able to communicate what nurses have done, leadership of nursing, and having the data to change care. A primary role for nursing is advocacy, and in being able to inform policy is part of the advocacy role for nursing, and it's something that we all need to be aware of doing. And if you think of informing policy as advocacy, and we know that's a primary role for nursing, it is something that you all can generate and provide this expertise. As I mentioned, my career in nursing started over 50 years ago with the care of Anne when I was a student at the University of Michigan. It has led me, and she's still on my shoulder, she still stays in touch with me, and it is through all of these connections, building off of this work with Anne, that I have had the trajectory and ending up in national policy-making positions in the federal government in the United States. So nurses, with their ability to document outcomes, can really make a difference. And I encourage you all to use this knowledge and take your knowledge of an individual, child, and family, working with the collective of all children and families, or adults and their families, and you can change local, state, and national policy. I wish you well.